Thank you for being here for today's webinar, Balancing Data Sharing and Protection, the COVID Measures Archive at ICPSR. I am Megan Chenoweth. I am a data project manager here at ICPSR. John, would you like to introduce yourself?
Sure. My name is John Kibali. I'm a research assistant professor here at ICPSR, and I'm the project director of the Social Behavioral and Economic COVID Coordinating Center.
Thanks. So one thing I want to mention is that today's webinar is part of International Love Data Week, an annual event featuring presentations from data organizations around the globe and hosted by ICPSR. If this is your first Love Data Week event, please know that there's lots more going on. You should visit ICPSR's website for a list of other upcoming Love Data Week events, or check out the hashtag LoveData24 on social media to see what people are saying about Love Data Week. Okay, so today's talk is framed by one big organizing question. It's Love Data Week, and we love data at ICPSR, but what do we do when data can't be shared? So ICPSR is primarily a data consortium, and just like Ken, whose job is just beach, we have one job, and it's just data. Sharing data as openly as possible has been the cornerstone of our mission for the 60+ years that ICPSR has been around. But sometimes data can't be shared for several reasons. One big reason is the need to protect the privacy and confidentiality of research participants. Researchers always need to take measures to ensure that participants cannot be personally identified, either directly within the data or indirectly by connections to other data resources. And then those restrictions are even more critical when research data touches on sensitive topics, contains personal health information, or involves people from vulnerable populations. Another big reason that data might not be able to be shared is that many researchers are using data from lots of different sources in their research, and some of that data can be proprietary. So some common examples might be records from private insurance companies, cell phone location data, and financial records from banks or from credit card companies. The owners of those data sources might allow researchers to use them, but not to share the data with others. And then finally, even researchers using non-proprietary data, like survey data from a data repository, might sign data use agreements that prevent them from resharing the data that they use in their research. So data sharing might be limited to comply with those data use agreements. Recognizing all of these challenges, agencies involved in open science increasingly encourage sharing data, quote, as openly as possible and as closed as necessary. And over the years, ICPSR has come up with lots of different solutions that address that challenge. One approach has been to develop systems and processes that allow depositors to go ahead and share their data, but make it available on a restricted basis. On the less restricted end, some studies have secure download processes that allow data to be downloaded, but put some limits on who can download it and for what purpose. On the more restricted end, for some data, we limit to either a virtual or a physical data enclave with limits on who can access the data, what technology is available, and what can be taken out of that environment. An alternate approach, though, has been to set aside the question of whether and where the data itself is shared and focus on tools that foster what we would call data custodianship, helping users discover and learn about data wherever it might be located. So one strategy you'll find for this at ICPSR is that in our data catalog, you might find what we call union catalog records. These records contain descriptions of important studies that don't have data available at ICPSR. The records contain links to help users find out where to locate the studies and how to get or request access to the data. And these are really powerful because they help users who are searching for data get the broadest possible sense for what could fill their needs, even if it's not available at ICPSR. Another tool that fosters discoverability for data that ICPSR doesn't hold is our Research Data Gov tool, which helps users explore restricted use microdata from 16 United States federal statistical agencies and apply to the appropriate agency for access to the data according to each agency's access standards. A third tool comes from NACDA, ICPSR's Aging Data Archive. Their Collectica portal lists all of the questions and measures from 3 major aging studies. It allows users to compare survey questions or measures across studies and understand the similarities and differences. And in September 2023, ICPSR launched our newest solution to foster data discoverability, the COVID Measures Archive, which is what we're going to be focusing on for the rest of our time here. Okay, John, can I hand it over to you from here?
Yeah, sure. Thanks, Megan. So Megan's done a nice job of kind of illustrating why, we undertook this project, but I think it'd be helpful before we actually get into the demonstration to understand a little bit more about the context in which we undertook this project, specifically how it relates to social behavioral and economic research on the COVID-19 pandemic. So with that, we can go to the next slide. So to start, as I mentioned, I'm the project director for SBE CCC at ICPSR, and the COVID Measures Archive is being directed by this coordinating center. And at SBE CCC, our role is to promote communication, collaboration, and data harmonization and sharing, particularly around studies that are looking at the social, behavioral, and economic research into the impacts of the COVID-19 pandemic. And in doing so, we foster connections across NIH-funded researchers and the social science community as a whole. So just a quick overview of our amazing consortium members. We have 15 NIH-funded research studies that are investigating a different topic within the domain of social, behavioral, and economic, or SBE research into the COVID-19 pandemic. I will note that we also have a couple fantastic cohorts of pilot grantees, and we will be doing an additional funding round for pilot grants sometime this fall. So if that might be of interest to you, please keep an eye out for that, probably around August, September. And so getting back to our consortium members, as you can see here, they're independent research teams from different disciplines. We have sociologists, economists, epidemiologists, medical doctors. It's a really, demographers, it's a really diverse and interdisciplinary consortium. And each of them are looking at their own research questions using different data sources and methods. But as a consortium, they have the shared goal of establishing consistency and comparability across their research. Next slide. Thank you. So with COVID data in particular, there are a number of challenges that we run into when we start looking at questions of transparency and open data and data sharing. I think some of these are going to be challenges that you run into with any kind of study that involves health data, where you have particularly sensitive data or identifiable data that you have to protect. But in the case of the COVID-19 pandemic, there were some additional challenges that got kind of added on top of the standard concerns around privacy and data protection. And so one of those is just kind of the rapid onset. And so there were a lot of initiatives for data collection and surveillance that had to be stood up in a very, very short period of time. So surveillance systems to look at COVID-19 cases, hospitalizations, data collection efforts to look at policy interventions to mitigate COVID-19 transmission and burden. All of those things had to be done really, really quickly, which doesn't necessarily lend itself to being able to really interrogate how we're going about doing that. You just kind of, when you're in an emergency, you have to kind of do what needs to be done in the moment. And so obviously this can lead to some potential challenges when it comes to data sharing or data harmonization, particularly with heterogeneity of measures, and potentially that leading to conflicting study results. If you're not measuring concepts in the same way, it's not necessarily going to be possible or easy to compare across different studies. And so oh, yeah, thank you. So how do we actually go about doing this, and why do we care so much about this openness? So particularly in an emergency like COVID-19 or another pandemic or outbreak, it offers transparency into data collection and methods. It allows this comparability between studies, which allows us to reach consensus. And it also fosters trust and confidence in public health guidance, which is something that I think we can all agree was an incredibly important and continues to be an important aspect of the COVID-19 pandemic. And so to get around some of these limitations with the data collection that was set up so quickly, and the sensitivity of many of these data, the data that were being collected, we came up with this kind of solution for the COVID Measures Archive, which we'll talk about now. So when you have when we talk about data sharing, we're often talking about sharing the data themselves, but there are also benefits that you can get without sharing the data, but you can share the data about the data, or the metadata. So when you can share data, you should do it. And we are happy and will gladly help and work with you at ICPSR. It's what we do. But we completely understand that there are times where it's just not possible or it's infeasible. And so in that case, an alternative that can still get a lot of use and get you a long way as far as kind of this openness and transparency is sharing the metadata. And what this allows us to do is that when you share your metadata with us, it's equally interoperable within the COVID-19 Measures Archive, and it's equally discoverable within the larger ICPSR data catalog. And so just some kind of quick numbers, where, as you can see here, we're currently up to about 19 studies, about 7,600, 7,700 variables from 6 depositors, and that is going to rapidly increase over the next year. So what are kind of who's the audience, I guess, that we're hoping will find benefit from this COVID Measures Archive, and what do we think that they will use it for? So our primary audience is researchers who are trying to design studies about the impacts of the COVID-19 pandemic. So using the COVID-19 or the COVID Measures Archive, they can identify other studies about the same topics that they're interested in looking into, and then actually dig into the specific individual variables within those studies. So for example, if they're designing a study or designing a survey, they can see how other studies have worded questions about the topics that are related to what they're interested in looking at. If they're looking for measures or instruments of complex concepts like stress or mental health, they can see what instruments other researchers have incorporated, and hopefully use those to inform how they're designing their measures or designing their surveys to increase that harmonization capability. Beyond that, the COVID Measures Archive is also useful to COVID researchers who are interested in comparing their own findings to other studies. So in doing that, you have to have a good understanding of how each measure or each variable was constructed or operationalized. And the COVID Measures Archive allows you to actually compare measures from different studies side by side. And this allows you to identify similarities or potentially inconsistencies across studies that would be fundamentally important and determine in that harmonization process. And then finally, the COVID-19 Measures Archive is also a useful tool for graduate students, for postdocs, or again, other researchers to discover data sources that can be used to study COVID-19 related questions. So even if the data is not stored at ICPSR, researchers and students can use the COVID Measures Archive to learn what data is available and where to access it. I know I've been working in the COVID space since it emerged in early 2020, and I'm still coming across data sources that I did not know exist. And so I think anything we can do to further amplify and improve that discoverability, I think is a really useful resource for the broader research community. So with that kind of additional context, I think I'll turn things back over to Megan, who's going to give a little demonstration of what the Measures Archive actually looks like. Megan?
Yeah, great. Thanks, John. Give me just a sec to grab the right browser windows. Okay. All right, hopefully you are seeing SBE CCC's website right now. Okay, so let me give you a quick tour of the COVID Measures Archive. So on our website, you can find the COVID Measures Archive under COVID-19 research, find studies and variables. Our COVID Measures Archive is a database of variables. So the first thing that you see when you land is a list of all the variables across all of the studies that are live right now. So let's say maybe a user is interested in the impacts of COVID on schools and students. I'm going to do a simple search for students and get 37 variables from 3 different studies. So I'm showing some of the variable names, their labels, names, labels, question text if it's there, the study that they come from. Some of these results come from studies that are held at ICPSR. Others come from studies where we have only metadata for that study and not the data, but they are presented and searchable alongside one another. So here is a measure from one of the studies that's cross-listed in the COVID Measures Archive. This is a study with data in it. I can see the variable label, the question text, this being a survey, the possible values and labels, frequencies, summary statistics, and a link to more information about the study. If I click through to the study, I'm able to view more context about the study design, methods. And because data for this study is available through ICPSR, I can also download code books, download data, and get information about applying for access to restricted data. But if we go back and look at a different result, I'm going to pick this one. This is a variable that comes from a metadata only study, but I can see a lot of the same information about this variable as I could for the variables for studies that are held at ICPSR. So I can still see variable names and labels, possible values. This being a created variable, there's a little context that explains how this variable was created, set to 1 if, depending on the value of another variable in this study. If I click through to the study, I'm again able to get some information about it, but this being a metadata only study, I'm not able to download any data, but in the summary and data source tab, I can still see information about where the study comes from, information about the data not being available through ICPSR, and in the data source field, information about where the data is derived from and where to access it. Okay, I'm going to let's look now at another example. I'm going to start my search again. This time, let's say maybe I am interested in the effects of political partisanship during the COVID pandemic. I'm planning a study of my own, and I want to see how others have measured partisanship in their own study. So I'm going to use an OR search for both party and partisan this time. to maximize my results. So that'll pull up related terms. So for example, partisanship for partisan. I get 6 results from 3 studies. I'm going to select 3 of them. One from the National Wellbeing Survey, one from the National Couples Health and Time Study, and one from the National Neighborhood Data Archive. And I'm going to go back up and compare them side by side. So for each measure, we can see its label, we can see its question text if it comes from a survey, we can see possible values, the time period that it applies to, and the universe, which is the group of people or the group of entities that that measure applies to. So in this example, the first 2 measures are survey questions from 2 different surveys. So the question text, we can compare side by side. We can see that it's not identical, but the possible values and the time frame are fairly similar. The third measure is getting at something a little different. It's a measure of the percent of Republican votes in a county over time, over 2004 to 2018. So this data we can see from the universe field is about counties, not individuals. So it shows a little different approach to a different kind of measure of partisanship. All right. Finally, there is just one last thing that I want to show you, which is, I'm going to jump over to ICPSR's website for this. COVID studies and measures, both the data that we've been looking at and the metadata only studies that we looked at as well, are not just available within the COVID measures archive, they're integrated with other ICPSR data, and they're discoverable within ICPSR's social science variables database, which I can find if I go here to search and compare variables. The SSVD is a searchable database of all variables within studies held and curated by ICPSR. So for example, let's say I'm interested in the financial and the economic impacts of COVID stimulus payments. So there are 5 variables of interest that come up from that search. The first one comes from a COVID measures archive study, the National Wellbeing Survey that we've just been looking at, a study that is cross-listed with SBE CCC and appears in the COVID measures archive. But the others come from other ICPSR archives. So for example, this one comes from, if I click through to the variable and then to the study, I can see that this one comes from NACJD, ICPSR's Criminal Justice Data Archive. So, so you can see one of the benefits of hosting the COVID measures archive on ICPSR's platform is that those measures are also accessible within the broader context of ICPSR's larger data holdings. All right, I am going to hop back over to our slides. Okay, and let me, John, let me hand it back over to you to wrap things up for today.
Yeah, thank you. So as you saw from that nice demonstration from Megan, and what we kind of talked about today is, what we've been trying to do here with the COVID measures archive is offer an opportunity to increase transparency and open science when data can't be shared. So, and looking for alternative paths to discoverability and transparency. And so, again, this is not to say that you should not share data. We fully say that you should share data when you can, but we also understand, there are very legitimate reasons and situations when data needs to be protected or restricted. And so in those situations, we really think, metadata should be shared. So share data when you can, metadata when you can't. That's not to say that, metadata sharing is not that's not to say that metadata sharing is a substitute for data sharing. But really, again, we understand that there's this need for balance. And so, I would say that, the way I look at open science is that it's on a spectrum. And so it's not a, all or nothing kind of thing. And that depending on the situation, depending on the data, depending on the research questions you're asking, you can kind of fall somewhere along that spectrum, with the goal being as open as possible, but as closed as necessary. And as you can see over here, we have a QR code and a link to the COVID measures archive. And so we invite you guys to go and take a look around yourselves. And please don't hesitate to reach out if you have any questions or comments about the measures archive. And with that, we want to thank our amazing funders. So SBE CCC is funded by a U24 grant from the National Institutes of Health, specifically the National Institute on Aging and OPSSR. So thank you to all of the wonderful folks that we work with there. We also want to thank the Love Data Week organizers and the amazing consortium members who have already been working with us on this COVID measures archive and making it into the success that it is. And with that, we have we provide our contact information down there, and we're happy to answer any questions you guys might have if you want to put them into the Q&A. Looks like we might already have one.
Okay. And I'm also going to put a plug in. If you pop to our website, we hope that you'll take a minute to join our mailing list. You'll receive occasional announcements about additional webinars like this one and other upcoming activities and consortium news. All right, I'm going to turn off the screen sharing and we can take some Q&A. Oh, I see. Is there a link to access a copy of the slides? Slides will be emailed to you after the webinar, so no link for them yet. Yeah, but we'll make sure to follow up via email after the webinar. Okay.
I can ask a question if nobody's got one currently.
Yeah, sure.
So I wonder, Megan, if you can talk about, so in case there might be, a researcher on this call, or, that's somebody that's on the webinar right now that has a study that might be interested in depositing data or metadata from that study to the COVID measures archive. Can you talk a little bit about that process and what that might look like?
Yeah. So if anyone is here thinking that they might like to deposit data, I would absolutely encourage you to deposit your data to ICPSR. We have lots of options depending on where study funding comes from, depending on your preferences for curation. ICPSR's deposit form will help you walk through each of those options. If you have metadata only, right now, our focus is primarily on studies from our 15 consortium members, but we have been exploring adding measures from some major social research studies that have adapted their data collections to COVID-19. So if someone thinks that they have metadata that would be a good fit for the COVID measures archive, I would say, please contact us, sbecccc-help@umich.edu. Tell us more about your study. We'd be happy to talk more about the specifics of your situation and options that are available to you. Okay, I see we have another question. And the question is, can you verify that the variables include not only ones that come from assessments within questionnaires, but also constructed from administrative data. I think I'll take this one, John, if that works. So yes, absolutely. So some of our data, the data that's both the data that's deposited with ICPSR and the metadata, we make a point of asking for not just what are the questions or components that go into those measures, but if you construct or create any variables, we'd like to know a bit about how those were created as well. So yes, you will see those side by side.
Just one other thing to add there is that when we have, and this is something that we've only, just kind of started working on, but we've had some limited instances where consortium members have, developed their own measures, and so we have another, platform at ICPSR called the Linkage Library, where we're actually working with them so they can deposit code, and it works very nicely with kind of a GitHub repository interface, but essentially so that if somebody has gone through the process of creating variables from administrative data or from large public data sets or from multiple restricted data sets, the code that they actually use to create those is publicly available for many of them, and so that's something we're trying to build in, so it's not just like the formula, because sometimes those can get kind of fairly complex, but actually having the code to create some of these variables, so you don't necessarily have to reinvent the wheel. So I just wanted to make sure to highlight that as well.
Thank you. John, I might ask you to tell us a little bit about what's next for the COVID measures archive. So do you want to talk a bit about new data or new measures that might be coming in the next 6 to 12 months?
Sure. So one thing we're particularly excited about is the U.S. County COVID Policy Database, which is a data set of state and county level COVID mitigation support policies that Rita Hamad at Harvard University, and she is one of our amazing consortium members, has painstakingly put together. And so we're in the process of getting not just the metadata, but also the actual data curated so that they'll be publicly available. We are also looking at we should be getting metadata from the National Health and Aging Trends Study, or NHATS. And this is our first non-consortium metadata deposit. Specifically, this is going to be the COVID supplement that they conducted, I believe, in 2021. We'll have an additional wave of the National Wellbeing Survey from Shannon Monette at Syracuse University, which we're very excited about. And then we've actually just recently added some new data, and we'll be adding some additional data from the National Neighborhood Data Archive, but particularly data looking at the pandemic's effect on neighborhood resources. So just a few of some of the different studies that we're excited to be adding to the archive here soon.
Great, thank you. Let's see. I'm going to give it, are there any last final questions? If not, we can wrap things up, but we do have another minute if anybody wants to ask another question.
If you do think of something after the fact, you can feel free to email us at that email that I put in the chat, the SBE CCC help email, and we're always happy to chat with folks.
Okay. I think we can wrap things up. Once again, our webinar today is part of Love Data Week festivities at ICPSR. So if this is your first Love Data Week event, congratulations, you're part of the party now. I hope you'll go over to our website, ICPSR's website, and see what else is going on this week. Thank you all very much for being here. A copy of the slides will be sent to everyone who registered for today's webinar after the session. We do hope you'll join SBE CCC's mailing list, visit our website to sign up to receive some information occasionally from us. And thank you very much for taking a little time to be here with us today. We appreciate it.